When you encounter something like dementia in the family, I think it's always good to get a doctor involved.
Mhm.
And a specialist like a neurologist is really, really important.
And today we are glad to have Dr. John Bertelson, who is a behavioral neurologist and specializes in all sorts of cognitive disorders. So thanks so much for being with us today.
And thank you, Kim. And Mike, thank you both.
Let's just start with, as we are with our parents and we might be noticing some changes, what are maybe the most common signs that we should be looking for that there might be some dementia that we need to address?
Right. So red flags for a dementia or a precursor to dementia would, I mean, there are many, but I think one of the big ones is look for a change in thinking, a change, and especially a worsening or increasing forgetfulness, repeating oneself more than one used to, maybe not being aware rather that someone is doing that, is saying the same thing or asking the same question. So kind of losing awareness of this being new and this being a problem, struggling to think of names of people that they used to come up with pretty well. Close family, even close friends, maybe someone you haven't seen for a while. And the holidays, this is a perfect time because you see people you might not have seen for 6 months, a year or so. And if you used to get their names pretty well and now it's difficult, then I'd consider that to be a concern.
Mhm.
Certainly, if you're noticing new difficulty with driving, bills aren't getting paid, medicines aren't being taken correctly. These are also pretty significant red flags that something may be going on. None of these by themselves are diagnostic of dementia
Mhm.
or mild cognitive impairment, but they're commonly seen, and especially when those disorders are caused by Alzheimer's disease.
Hmm.
And they certainly would warrant further investigation.
Mhm.
I think there are a couple of big problems that a lot of adult children have with their parents trying to see a neurologist. And the first one is that a lot of parents say, I don't need to go to the doctor. What should we do about that?
Yeah, that's tough because, as I was sort of alluding to, people who have, especially Alzheimer's disease or Alzheimer's dementia, usually or often don't know how much of a problem they're having,
Yeah.
and so they sincerely feel that I'm fine or this isn't that big of a deal. And there may be some defensiveness that is present in people who do know there's a problem, fear of what the unknown is, or fear of
Mhm.
what might be happening. So there are a number of reasons why someone might behave that way. I would say every family is different. Every circumstance is different. You've
Yeah.
got to be prepared to try many, many different options.
Hmm.
Sometimes it helps to start with primary care, start with a doctor that the loved one already knows very well. So it's
Mhm.
maybe less threatening than seeing a specialist, someone they've never seen before,
Yeah.
and then maybe bring it up with that primary care doctor.
Mhm.
Um, I think another uh, uh, tip or trick that someone might use might be to say, hey, there are new medications that are available, and which is true. There are things that are coming out that we haven't had a few years ago. Maybe say, hey, I'm worried about you. I'm worried there may be a problem. If things get worse, it's going to be harder on me as the adult child. And so do this for me. Help me help you better, because it's going to make everyone's lives. And not that you want to guilt someone necessarily, but
Mhm.
if it's the honest truth and you say, hey, it will be harder if you get worse, if there's a problem, and it's going to make it difficult for myself, for your grandchildren, my own children. So definitely use what you have to do, but it's not one size fits all.
Yeah. I,
What? Oh,
I
go
was just
ahead.
going to say that I think the other big problem that a lot of people have is when they are able to talk mom or dad into going, then doctors like you are just so popular that they can't get in for 3 or 4 or 5 months. Do we need to worry about that?
Yeah, it's different markets are different.
Yeah.
Some markets there's less of a shortage than others, but here in Austin, while there are plenty of excellent neurologists, the demand is so high for our services in general
Mhm.
that even sometimes if you have a headache or something very different, it may be hard to get in a timely manner.
Yeah.
So I think it really is important to start with primary care. Start
Mhm.
with primary care because they can do so much. They can do some screening quizzes. They can order some basic tests
Mhm.
that they usually will know what we need. And so when if I would say if and when your loved one gets in the door of the neurologist, a lot's been done already, so you're not having to start from scratch.
Mhm.
Um, and I would say also advocate, and if you're for yourselves, and be flexible. If
Mhm.
there is some availability to get on a wait list, for example, cancellations happen all the time, and so if you are able to be available on a moment's notice, that can help quite a bit as well.
What's the benefit or importance of actually getting a diagnosis? Because I think a lot of times parents, may not want to face the fact of maybe this is what it is. So what are the benefits of actually having a diagnosis of a specific, whether it's
Specific dementia.
which type of dementia it is? Well, if it's dementia at all, and then the importance of which type it is.
Yeah, and those are two very important distinctions. Is this dementia or is this a precursor to dementia? And if so, what type? For the first question, if the forgetfulness is due to a hormone deficiency or depression can mimic dementia in serious cases. And so, first of all, you don't want to miss something that's treatable. You don't want to miss something that might be at least treatable very differently.
Right.
You can improve thyroid deficiency with a supplement. You can, with talk therapy and medication, depression is often very responsive to treatment. So again, you don't miss the fixable, treatable things, at least the easily treatable things. In terms of if there is a neurologic disorder like dementia, then the subtypes is important to know because they progress differently. And we, and on the medical side, can sometimes predict what might happen if we have a better idea what the name of this is. Is this Alzheimer's disease or Lewy body disease or frontotemporal dementia or any number of things? We can help patients and families plan for the future by knowing, okay, it's likely that this will happen in a couple of years, or don't worry, this other thing probably won't happen. And then for Alzheimer's in particular, especially the early stages, there are some new medications available that are given and are only appropriate in the early stages. And so there are many reasons why it's important to know, A, is it a neurologic problem or not? And B, if it is, what's the type?
And you brought up a good point that maybe would it be helpful to let our parents know that if this is what we're facing, like Alzheimer's, to be able to get treatment, we need to know earlier than later for it to be effective?
Right. And there are many reasons other than stage why a drug might not be appropriate. But yeah, that's a good one. That's a good. We can do more in medicine in general, but certainly in this field now, we can do more, and we can do more appropriately if we know things as soon as possible.
If that helps, try to get them in for testing.
Do you find that a lot of people, or maybe the adult child, do too much self-diagnosis where it's basically, I've got Alzheimer's, I guess there's nothing that can be done, and you figure out, oh no, it's this type of dementia, like the other ones that you mentioned earlier, to where that's maybe a problem that we have as non-doctors, that we self-diagnose too much?
I think it can happen for sure. Most of the people that find their way in my door are older and really do have dementia or a precursor to dementia. But sure, my patients often come with their adult children who are aware or are concerned rather, are thinking, hey, I see mom or dad, this is the path they're going down. I'm getting a little forgetful. I'm 45, 50, 60, whatever. This is inevitable. This is going to happen to me. And I would say not necessarily. Sometimes yes, but it may be due to stress and balancing children and parents at the same time, often working on top of that, wrapping up one's career. Any number of things can be really, frankly, overwhelming. And we all have our limits, and we all have our points where, hey, this is too much, and I'm getting forgetful because there's too much on my plate. And so it is easy to at least have the concern about overdiagnosing oneself. But I think I would encourage one, obviously, not to do that and not to always assume the worst.
Yeah.
Well, and you mentioned the precursor to dementia. At what point, should you be maybe getting tested, if you will, even when you're on the younger side? So that, is it important so that you have some sort of a baseline, or what's the difference in some ways, or what is being diagnosed or knowing that you've got a precursor to dementia? What does that offer?
Yeah, so dementia is a symptom and Alzheimer's is the cause. So we think about this in with almost like two different diagnoses. What's the diagnosis of the symptom and what's the diagnosis of the cause? And so in terms of dementia, you don't usually wake up, boom, with dementia unless you've had a stroke overnight or something. Usually it's a progressive process. And we often go, at least in Alzheimer's disease, from subjective cognitive symptoms, or, we think something's going on, no one else can tell, to mild cognitive impairment, where there is a measurable change in thinking, but one can still pretty much do all the things they needed to do, drive, shop, whatever. And then dementia, which means that we now have a difficulty or inability to do something we used to be able to do before. We can't find the grocery store. We lose our car in the parking lot. We're consistently missing medications. We're consistently missing bills. And so if you think about it, mild cognitive impairment and dementia are really different stages of the same disease. And so if we recognize the importance of diagnosing dementia early, then it's even that much more important and sometimes more powerful to diagnose it before it becomes dementia, because these medications we talked about are usually, at least some of them work better in the earlier stages. Mm-hmm. And also it's easier for someone to help plan for the future, for a parent to help contribute to the planning process, thinking about their future, if they have awareness, if you catch this condition before the insight is gone. If nothing happens, nothing is diagnosed, counseling doesn't happen until dementia is present, then the loved one, the parent, may be unable to meaningfully contribute to that discussion. So really, they can be more engaged and involved in their own future the earlier something is identified.
Sure. And do you see, or are there even more promising treatments coming, do you think? I know that's kind of a loaded question, but.
Yeah, I do. I see them. I see that coming. Now, we've been saying that. I've been in practice for 20 years now, and we would say this over and over again. In the next 5 years, there's something that's going to be there. But now finally we have medications that really target at least part, they target what many neurologists believe is a critical component of Alzheimer's disease. Mm-hmm. And it's medications target the amyloid protein in the brain. And again, most neurologists feel that this is part of the cascade, that amyloid is pathologic. It results in another abnormal protein that accumulates, and then together there is Alzheimer's disease. Mm-hmm. And the medications, there are 2 medications in this family that are now FDA approved. There may be more coming soon. And there may be medications that affect other steps in this process in the next few years. And it may get to the point where we treat Alzheimer's disease like we treat cancer, with many different drugs simultaneously acting at different parts of the tumor. In this case, acting in different stages or parts of the Alzheimer's pathologic process.
Yeah. Any suggestions that you might have for adult children as you are interacting with your parents who have dementia and or Alzheimer's or another form of dementia? Because there can be a lot of frustration as the adult child when you're trying to learn how to communicate with them when they are progressing through the process. Any suggestions that you might have for just us as the adult child as we're getting frustrated with them?
Yeah, well, I think recognize first of all that frustration is normal, because this is challenging for the adult child, for the patient, for the parent. It's frustrating for everybody, and so I think it's important to recognize that these are normal human reactions, and not that we want to encourage frustration, but I think recognize that we're all human and we all have our limits. And I think when we recognize that we have limits, we might be better equipped to identify when we're approaching the limit and try to do something so we don't cross that threshold. Mm-hmm. And it may be taking a break if you feel that things are getting difficult. If you can step out of the room, maybe end the phone call and resume the phone call later. Mm-hmm. It may take help distracting your parent to get them thinking about something else, so their mind isn't on whatever subject that may be stuck in a loop mm-hmm. that just gets frustrating, addressing over and over and over again. So again, it really there's no one answer that fits all, because different adult children have their own needs and stresses. The adult or the person with dementia has their own baseline personality and their own needs. So it's really complicated. Mm-hmm. But so I think it's just and also maybe recognize what worked before. If just because someone has dementia, it doesn't necessarily mean their personality is completely different. Mm-hmm. So if there was a way to diffuse conflict 5-10 years ago, it may still work. It may not, but it's worth a try.
Yeah. And how do we know when it's time to get the neurologist involved?
Yeah, that's a tough question, because then again, we're thinking about what's the availability of the neurologist in your community. I think it it often depends on what the primary care doctor is comfortable with.
Mm.
I don't believe that every single person out there with dementia must see a neurologist. And frankly, it's probably not possible for every person out there to see a neurologist based on access in the community. There are cities, counties without a neurologist at all. And so I think just recognizing that not everyone has to see the neurologist.
Okay.
But certainly if either the primary care doctor seems uncomfortable or uncertain, and I would encourage you to ask that doctor that, say, respectfully, of course, but just make sure they're comfortable with what's going on, because as physicians, we all have our pride, and we shouldn't feel that we're giving up on someone needing and asking for help. And so you try to have that honest, open dialogue with primary care. But I would really start with primary care and see if you're getting what you need to get from that individual before assuming that a neurologist has to become available or involved.
Yeah.
Great words of wisdom. Dr. Bertelson, thanks so much for joining us.
My pleasure. Thank you for having me.
We really appreciate it. I think he used the word overwhelm earlier.
Mm-hmm.
We talk about that all the time. You get overwhelmed, but he gave us some great tips about how to get through it, how to survive, and how to accept what's going on.
Absolutely.
Hey, if you have any other topics you'd like us to discuss, please let us know. Parenting Aging Parents.